Dr. Brian Rostron is a health scientist in the epidemiology branch in the Office of Science at FDA Center for Tobacco Products. He holds an MA and PhD in demography and an MPH in epidemiology from UC Berkeley. He was a fellow at the National Center for Health Statistics for 2 years before he joined FDA and CTP in 2010, where he has worked in the statistics and epidemiology branches in that office. So I think going back to 2010, which means that Brian was one of the early early birds after the center was set up following the Tobacco Control Act of 2009. He's worked on a variety of research projects at CTP, including survey and biomarker data analysis, as well as estimation and modeling work on flavored cigars and nicotine reduction, which we'll get to hear a little bit about today. So very nice to welcome you here, Dr. Rostron, and I'll let you take it from here. Thank you.
All right. Thank you, Jamie. Okay, as Jamie said, my name is Brian Rostron. I'm a health scientist in the Office of Science at CDP at FDA, and I will be talking about some population health estimates of the impact of flavored cigar restrictions. As you see, there's a standard FDA disclaimer. This is not a formal dissemination of information by FDA and does not represent agency position or policy. More specifically, at the end of the presentation, I'll be giving some general observations about potential updates and extensions to this approach, but those should not be taken to indicate anything that FDA has or has not done non-publicly. So I'll be talking about published estimates that FDA has put out. Going back almost, the beginning of this work was probably about a decade ago. FDA CTP staff in 2019 published preliminary estimates of the potential impact of prohibiting characterizing flavors other than tobacco in cigars on U.S. population health in the International Journal of Environmental Research and Public Health. Specifically, we looked at the potential impact of a comprehensive national flavor prohibition for cigars on reductions in adult cigar smoking attributable mortality, as well as reductions in youth use of cigars. And then updated estimates using the same approach were published in FDA's Notice of Proposed Rulemaking on flavored cigars in 2022. And you can see the notice in the Federal Register. So for the 2022 estimates, in terms of what we might call a cessation benefit, as I said, in terms of mortality reductions, we estimated the effect of the prohibition on current adult cigar smokers in terms of cigar smoking attributable mortality. And we used published estimates that were available at the time on the effects on total cigar sales in terms of units from evaluations of New York City, Providence, Rhode Island, and San Francisco flavor restrictions. And so our general estimate was a 30% decrease in cigar sales with a range from 15% to 42%. And obviously each of these restrictions differed in terms of what products were covered for cigars and other tobacco products, also the degree of compliance and enforcement. And we assume that half of the decrease in cigar use would come from cigar smoking reduction, as in people smoking fewer cigars, and half from complete cessation, consistent with cigarette tax literature. And we only assumed there would be a mortality benefit from complete cessation, even though to some extent, from the cigarette literature, there's a suggestion that, substantial reductions in combusted use could have some benefit. So it's a conservative assumption. And then we also use previously published estimates that we and colleagues at RTI had published of estimates of cigar smoking attributable mortality for the US. And we restricted this to exclusive users, meaning cigar smokers who did not smoke cigarettes, given that these dual users could potentially substitute, to some extent, cigarettes for flavored cigars. And so the general estimates are for these 5,200 deaths among exclusive cigar smokers. We then multiply that by 30% for the decrease in total cigar use, as well as 50% for the reduction in cigar use that would come from complete cessation. And so rounding, we get approximately 800 cigar smoking attributable deaths that eventually would be averted per year. And we also conducted a Monte Carlo simulation, varying the inputs for the effects on total cigar sales from the flavor prohibitions, as well as assumptions about the decrease that would come from complete cessation. And so we get a 90% prediction range going from 400 to 1,100 cigar smoking attributable deaths per year. So we also looked in these estimates at reduction in youth use. And so the bottom line is that we got about 60,000 fewer 18-year-old current cigar smokers in the US for a particular cohort. And so again, just very briefly with the schematic, we would start out with 4.26 million 18-year-olds in the US in 2019. Of those, according to Pathway 5 data, approximately 3.9% of those 18-year-olds were everyday or someday cigar smokers. Again, from Pathway 5 data, close to 65% of those 18-year-olds who were cigar smokers initiated with a flavored cigar product. So we have 106,000 18-year-olds, current cigar smokers who initiated with a flavored cigar product. We then look at sort of the impact of a flavor prohibition, and we assume a 32.5% reduction in cigar initiation. This is every use. Again, we take that, we find that from the midpoint. Sort of lower bound, we assume will be no reduction in cigar initiation, as in like everyone who is a current cigar smoker who would have initiated with a flavored cigar would instead initiate with a non-flavored cigar. And the upper bound would be the 65% reduction as an upper estimate based on essentially the close to 65% of the 18-year-olds who initiated with a flavored cigar product. And so the midpoint would be 32.5% reduction. And this results in a reduction in 34,000 initiates. We also, again, based on the information that we've seen previously, we include a reduction in continuing cigar use based on the observed association between flavored cigar use and greater likelihood of being a continuing cigar user. We take estimates from Valente et al. In 2019. And so our main estimate is a 35.9% reduction in continuing cigar use with a lower bound of 22.5% reduction, upper bound of 46.5% reduction. And so from that, we get an additional 26,000 continuing cigar smokers who would be prevented from continuing cigar use. And summing all that up, we get a total of 60,000 current cigar smokers among this particular 18-year-old cohort who would not be cigar smokers. And again, we once again did a Monte Carlo simulation. We get a 90% prediction range going from 42,000 to 75,000 smokers who would be prevented. Now, one of the things obviously is that these estimates, and they're really just estimates, were current point in time estimates. And so ideally, we'd obviously want to factor in change in cigar use over time. And certainly modeling could be very useful here. Extend these estimates over time and count for changes in prevalence. Now, one thing that would need to be considered, obviously, is the existing trends in cigar use prevalence for both adults and for youth. And as you can see, for adults, I presented published estimates of current cigar use for adults in the National Health Interview Survey. And as you can see, they're rather consistent. Initially, NHAS had a 50 cigar lifetime ever use threshold analogous to the 100 cigarette threshold that's often used. And so for the first period, we have those estimates. And then more recently, NHS has had annual estimates, but without the threshold. So I've included that. Obviously, in 2019, there was a survey redesign for that survey. But generally speaking, the estimates before and after were very consistent. And certainly over the 20-year period as a whole, adult cigar prevalence has been rather consistent. Now, for youth, obviously, it's a very different trend. What we've seen is a fairly consistent decline. And again, this is from the National Youth Tobacco Survey. Beginning in 2000, we have close to 15% cigar use prevalence among high schoolers. And then from certainly say 2011 on, we have a fairly substantial, if not dramatic, decrease in high school youth cigar prevalence, such that by 2022 it was down to 2.8%. Although I would note that this still, in absolute terms, I believe represents something like 500,000 high school students. So in absolute terms, it's still a large number, although certainly there is the trend over time of a fairly substantial decrease, which would appear to parallel the decline in cigarette youth prevalence that we would get from a survey such as MITS. So certainly any kind of modeling would to some extent need to consider and take into consideration these trends. Personally, I think it's somewhat surprising that we've yet to see a decrease in adult cigar prevalence given the change that we have seen for youth, although again, that might suggest different use patterns. Just looking at the data, I think it's quite possible to infer that some of the decrease in youth would probably occur among experimenters, especially experimenters with cigarettes. And so that's been reduced. Now, again, as I said, these are just sort of general observations about potential updates. First, in terms of mortality estimates. As I said, we at CTP, for example, myself, Ben Appleberg, Patricia Hall, as well as colleagues at RTI, published estimates of cigar smoking attributable mortality for the US in 2010. So, those estimates were published about a decade ago. Certainly those estimates could be updated with more recent prevalence data. We actually use the National Adult Tobacco Survey, NATS, which I don't believe has been fielded for some time. But obviously, as we've seen, other data sources available. At this point, we have annual estimates from the National Health Interview Survey. Obviously, we now have the PASS study, or there's also NISDA, the National Survey on Drug Use and Health. Prevalence, as we've seen, can be estimated various ways. Certainly using regular use, whether that's a threshold, if available, some measure of established use as is available in PATH, or frequency in use. We actually, I believe, used for prevalence for regular users having used on 15 of the past 30 days to sort of match up prevalence to the extent possible with relative risk data available from the cancer prevention studies. But certainly that's not necessarily what has to be done. Or obviously sort of any current use could be used. Everyday or someday use, as in the National Interview Survey, or past 30-day use. And as I said, for the most part, in our estimates at the time, given what was available, the relativists were from the cancer prevention studies of the American Cancer Society, mainly CPS2, with mortality follow-up generally in the 1980s. I believe CPS2 began in 1982. But in some cases where we did not have available data from CPS2, we actually went and used CPS1, which I believe was initiated in 1959. So obviously, again, it's been some time, even from the 1980s. So more recent data are available to some extent that have been published since then, including estimates from the National Longitudinal Mortality Study, which is available, as well as going forward, the Tobacco Longitudinal Mortality Study, sort of the successor of the NLMS with a much larger sample size. So these estimates would be more recent, in some cases more detailed. We actually estimated mortality by cause, and there were some causes such as COPD, where there was certainly indication and reason to believe that cigars would produce that type of cause, but we did not have a statistically significant estimate, so we could only include it in sensitivity analysis. So certainly updates could be made. And similarly, updates could be made with regard to flavor restrictions and the impacts of flavor restrictions. I believe when we started this work, as I said, we literally just had evaluations of the New York City flavor ban, which were very useful and informative, but that was one particular policy, and inevitably issues of compliance enforcement. Over time, we then had the Providence, Rhode Island evaluation, and finally the San Francisco evaluation. But obviously, many states and localities have implemented flavor restrictions of various kinds. So going forward, there are additional evaluations all the time. Additional, localities have enacted these kinds of restrictions, and results from evaluations of their impact on cigar use could also be considered. And I believe, people have been doing this work. I believe I saw, for example, a presentation at this year's SRNT combining data from multiple states and localities using a regression approach, which would be very, very useful. And then finally, as people discussed, Dr. Levy has discussed, an expert elicitation on cigar initiation and cessation with a flavor prohibition could also be conducted, although as he noted, expert elicitations do require a good deal of effort. And so generally, again, as I said, that's generally what I have to present. These were estimates that we have done and published, but obviously much more could be done. And these are just a few of the references that we and others have published that I've used in this presentation. Thank you.